Hello, it's CJ. Today I want to talk about the most common form of hormonal disorder in pregnancy, thyroid disease, which affects approximately 5 to 7% of patients and, unfortunately, if left untreated, can cause complications for both mom as well as baby. We don't routinely check for thyroid disease unless, of course, you have a known history of thyroid disease or if you are showing symptoms that your thyroid is not functioning properly. Today I'll tell you exactly what symptoms you should be on the lookout for. There are two different kinds of thyroid disease. The first one, the most common, is hypothyroidism. You'll also hear it referred to as Hashimoto's. In hypothyroidism, your thyroid is not working properly and does not produce enough hormone. Patients who have hypothyroidism will often have unexplained weight gain, fatigue. They may feel cold all the time. They may notice that their skin is dry and their nails are more brittle. You can also have increased nausea and vomiting during your pregnancy. And finally, you are at increased risk for miscarriage. And untreated hypothyroidism increases your risk to develop preeclampsia or gestational hypertension and anemia. It also increases your risk for preterm delivery. It is very easy to diagnose hypothyroidism with a simple blood test that can be ordered by either your primary care provider or your OBGYN. If your thyroid levels are elevated, here's what you can expect. You will probably be started on medication that is very safe for you to take in pregnancy. Depending on how high your levels are, you might be referred to an endocrinologist, a doctor who specializes in thyroid function. You will probably have your levels checked about every 4 to 6 weeks, and they will adjust your medication to keep you in that sweet spot. You may also be referred to a high-risk doctor for a level 2 ultrasound. The second form of thyroid disease is hyperthyroidism. You'll also hear it referred to as Graves' disease. In hyperthyroidism, your thyroid is producing too much hormone. These patients will often feel hot all the time. You may feel your heart racing out of your chest. You may have tremors. You may have unexplained weight loss. You may also notice that your eyeballs are protruding or slightly sticking out from your face. If you have untreated hyperthyroidism in pregnancy, you are at increased risk to develop preeclampsia, to deliver prematurely. Your baby may not weigh as much as he or she should, and your baby is at risk to have thyroid dysfunction when he or she gets here. So if you are diagnosed with hyperthyroidism, here's what you can expect. Depending on what your levels are, they may send you to an endocrinologist, again, a doctor who specializes in thyroid dysfunction. You may be started on medication, which is absolutely safe for you to take during pregnancy. We'll probably check your thyroid levels on a regular basis and adjust your medication as needed. And finally, depending on the severity of your hyperthyroidism, you may have more frequent testing and growth scans. So what questions do you have about thyroid disorder in pregnancy? I hope you'll leave those in the comment section below. Oh, and while you're in that comment section, I would also really appreciate it if you'd hit the like button.
If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.